The opinions expressed in the following program are not necessarily those of Eastlink TV, its sponsors, or partners.
Au Naturel is sponsored by Trophic Canada.
Welcome to Au Naturel on Eastlink TV. I'm naturopathic Dr. Callie Simmons.
And I'm Dr. Lana McManaman.
Today's topic is oral health, and we're going to be talking about the various conditions that can affect your mouth. And as naturopathic doctors, we like to reiterate over and over again the connection between the different body systems. And because I think in our society and how we approach health, there's plenty of separation. You know, you go to the ears, eyes, nose, throat guy, and then there's, or woman, sorry, I should say, gastroenterologist. And sometimes the connection between the systems maybe get disconnected. And we're really happy to have Dr. John McManaman. He's an orthodontist, join us. He has a practice in PEI and through a few throughout the Maritimes, and so he's going to be telling us the connection between your oral health and orthodontics as well.
So we're going to focus on our part on some of the different oral conditions. So firstly, we'll talk about the herpes virus or cold sores, which again is, what are you laughing at?
Because I'm sporting a little mini one today.
Yes, and Callie has one today, as you can see in her bottom lip. Yes, and that is caused by the herpes virus. So naturopathically speaking, how would we treat that? There's lots of things we would do. For example, licorice root is an excellent antiviral. In particular, it is good against the herpes virus. Also, we would look at, there's a connection between not enough lysine and too much arginine. So if you're kind of feeling more of a maintenance dose, you could take lysine daily and take higher doses when you do feel a cold sore coming on. Oil of oregano has some antiviral properties.
And what I would have to say, as a live model, that it's actually been suppressed now, and yesterday with a ton of oil of oregano in a big black licorice blob on my lip, it's now just like a little raw spot. So it didn't actually bloom.
And you can get these great topical roll-ons that you can keep reapplying all day. Calendula is really good. Melissa is another botanical that's to help with the herpes virus, vitamin C. And again, it's about the immune system really too. It's about, most people are exposed to the herpes virus, but not until your immune system's depressed enough to perhaps you're going through a really stressful time. Some people, if your first exposure to sun. So it's about keeping your immune system really strong with vitamin D, and well, we can talk about that a little bit too, and eating well as well.
And B12 and B6 in particular, just because they're such important nerve nutrients, and of course they're depleted by stress, but that characteristic tingle, and you can get this virus in your nose and on your gum tissue as well, and sometimes it can be hard to differentiate between that and a canker, but there's more of a raised quality and that swollen sort of numb feeling.
And it can actually be in your nose or on your cheeks as well, so it's not just isolated to the mouth, but more commonly people say, I get one and I get it here, I get one, I get it here. And it can, it can come out at any particular time. I guess that's what I'm saying. You could start at 35 years of age. All of a sudden, your immune system's down enough, and there you go, you get one. Another condition, the chelosis. I'm not sure if I'm pronouncing that right, but it's you find often kind of that burning sensation, cracking, in particular at the corners of the mouth. Sometimes your tongue will be red and swollen. It's been linked to B12 deficiency, B vitamin deficiency, in particular B2, iron deficiency. So it's about trying to figure out what is going on.
That's scalloping on the edge of the tongues if the tongue's too big for the mouth. Now, which we'll be getting into in orthodontics, is many people have a narrow arch, and so whether that tongue, from a developmental point of view, was designed for a wider palate than it should be, and other factors interfere with the skeletal development, then maybe that's another way of correcting irritations.
But if it is a deficiency, there's lots of, by taking B vitamins, taking methylcobalamin, sublingual B12, perhaps a B compound, so depending on what you may need, there's a lot of things that we would look into trying to rectify that deficiency.
And then just general inflammation, gingivitis, the swelling of the gum tissue, and you can see your gums bleed easily, and they're very puffy, and there is hormonal states such as pregnancy that can make you more susceptible. But I personally find I've been through a lot of pregnancies, and at times really tired, and But I think my diet affects my gum tissue more than anything, and I've been very consistent with oral hygiene. So here's some other things that maybe we wouldn't get talked about at your dentist or with your orthodontist, and is addressing food allergies and sugar consumption, not just getting it off your teeth, but how that can contribute to your gums getting swollen.
And naturopathic medicine may have something to offer for, there's a condition called burning mouth syndrome. Now, I believe it's not, a very common condition, but people get that sensation where their tongue is burnt and it just doesn't go away. There's been there's great research, there's a study done on alpha-lipoic acid at high doses for a period of 6 weeks, which seems to decrease that sensation. So something like that may be of benefit to somebody experiencing that.
And it's important with that alpha-lipoic acid. There's two forms occurring in nature, an R and an S form. Most molecules, to make this not too technical, rotate one way and the other way, and there's an active form and an inactive form. So it should say R-lipoic acid on it, and there's only a few companies that make that.
And the dose, in particular this study, they did between 600 and 800 milligrams a day, so it's something you do want to consult with a naturopathic doctor, while you're doing it.
And on the issue of periodontal disease, where there's a recession of the gum tissue, again, we'll learn about how brushing too hard or just chronic sort of trauma, clenching and different things like that can affect it. But interesting research on coenzyme Q10 at 300 milligrams a day, helping to slow the progression of that.
Thrush is another. We're talking about a yeast overgrowth in your mouth, and oftentimes babies will get that, and adults, they can get that as well, especially after using corticosteroids. And we really look at that yeast or candida as a really stubborn organism, and you really want to use some things that are going to kill that yeast. So whether it's grapefruit seed extract, oil of oregano that we've mentioned before, probiotics. There's a soil-based organism called lateral flora, so there's lots in there. There's different mouth rinses that we can use, and oftentimes they use the gentian violet for babies in particular.
Yeah, and that's what's nice about, I think they changed lateral flora to flora balance, if you're ever looking for that. It's a little confusing. And it doesn't have any taste, so it's great too if you're looking for something for a baby or a child that's not going to take oil of oregano, grapefruit seed extract, which taste horrid, and very safe to use at the the earliest of ages.
Cankers is another, some people come in and they, somebody may say they've never had a canker before in their life, and other people, they, get them all the time, depending on, you'd look really at what their diet and what they're eating. Are there any possible food allergies that are contributing to that? B12 deficiency can cause cankers, so looking into that vitamin, and you can get that through a blood test. And that blood test, the ranges are so, when you get B12 checked, it's between 135 to 735, I believe, but it's a big range, so I know we like to see people on the upper end of that range as well.
And I don't know about you, but I will get and especially when the kids smack me in the mouth with these braces, and so then you get a cut, and then it's traumatized tissue, and it's more likely to be a canker or a cold sore. But generally speaking, I feel like when I'm not eating right, or I'm stressed, it's a lifestyle factor, very much, that I will get this. And
folic acid, you can do a folic acid rinse, and in particular, I believe for mouth ulcers, they say it's very good to heal them. So it's higher doses of folic acid in a kind of a rinse and spit kind of thing. But that, and like you said, CoQ10 is really great for, and vitamin C is really good for, gum health.
But also, say, licorice. And if you're on high blood pressure medication, you can always use a deglycerized licorice, since regular licorice isn't good for someone with high blood pressure because it can raise it. And L-glutamine as well for any of those. But really addressing why, So we're big on trying an elimination diet for a while, and see what you think. Lichen planus, I've only seen this a few times, but the biggest success, the 2 times that I saw it, was with association with food allergies, and these 2 cases seem to be more of a cow dairy allergy. It's almost in an autoimmune category of the mouth, I believe, and it's you might think it's thrush, but it's sort of like these white patches.
If we want to touch on a little bit about toothaches or teething in particular in infants, there are some things naturopathically available, some different homeopathic remedies which are very safe and gentle. Chamomile is a really great one for teething to help a baby deal with that, and clove oil, I believe. It's a great, but you have to make sure you dilute it with a bit of olive oil, a couple of drops in a tablespoon, and you could try it on yourself first, but just mix it all up and use a Q-tip. And
you put on yourself and you get on your tongue, it'll be numb for a couple of hours. So, and it's actually sort of sweet tasting, so babies like it.
It's a great alternative to, you know, what a parent may be using.
Like Amazon or whatever.
Yeah, we've run out of time. We'll be right back. We're excited to be joined by Dr. McManaman. Like Callie said, he's an orthodontist practicing here in the Maritimes. We'll be right back, and thanks for watching Au Naturel on Eastlink TV.
Au Naturel is sponsored by Trophic Canada.
We practice science-based natural medicine and have 8 years of post-secondary education. Naturopathic doctors cooperate with your medical doctor, and visits are covered by most health plans. More information at simmonsmcmurrnaturopathic.com.
Recently, Stats Canada reported that 71% of Canadians use natural health products. The Root Cellar's experienced staff can help you choose which products best suit your needs. They also know to direct you to your naturopathic doctor, family doctor, or pharmacist. The Root Cellar, Charlottetown.
Craft services for Au Naturel were provided by Finley's Diner and Dairy Bar.
The opinions expressed in the following program are not necessarily those of Eastlink TV, its sponsors, or partners.
Welcome back to Au Naturel on Eastlink TV. I'm naturopathic Dr. Callie Simmons, and today we've been talking about oral health, and now we're going to be discussing the role of orthodontics in your health, and it's not just for a pretty smile either. We're joined by Dr. John McManaman, who we're really pleased to have, and he has several clinics, so welcome.
Well, thank you for having me.
Can you briefly tell us about what's the difference between an orthodontist and a dentist? And you can also, where are your clinics?
Well, my clinics are in Moncton, Charlottetown, and Summerside. And I work with 3 other orthodontists, so we're a group of 4 orthodontists that cover those 3 practices. And I guess to answer your question about the difference between a dentist and orthodontist, well, an orthodontist always has to be a dentist first because you have to graduate from dental school, and then to become an orthodontist you have to continue on and do another 3 more years of education, which is a master's program, so you have to do a lot of research and actually write a thesis before you graduate. Whereas dentists can do orthodontics as well, but mostly limited orthodontics because they don't have the education or training that we do.
Yeah. Because sometimes people will opt to get from their dentist probably because it's sort of a trade-off. Anyway, I guess it's reduced expertise and sometimes less payment, but is that why some people would go to the dentist as opposed to an orthodontist?
Well, I mean, I think so, or dentists sometimes are comfortable doing simpler cases, so, but I do really think that you're probably in better hands with an orthodontist, and often the cost of going to an orthodontist versus a general dentist doing orthodontics is, I think the cost is very similar, especially if you weigh the pros and cons.
Yeah, I know my dentist certainly wasn't willing to put these babies on.
Can you talk about how maybe orthodontics have changed since, you know, you would have had braces?
I was 13. 25 years ago. How depressing is that? You know?
So how has it differed from when she first had braces to when she has them now?
Well, orthodontics changed a lot, and I had orthodontics when I was about 15, and it's been more than 25 years ago, so we won't talk about that. But the biggest change is that orthodontics, the forces we use these days are very gentle and biologically compatible because the technology of the braces and wires has changed so much. Like back in the 80s, the forces were really extreme forces that used to hurt. Nowadays, I ask adults after they come back from one adjustment if they felt much discomfort, and a lot of them said they were pretty shocked that they didn't really have any pain or discomfort at all. It just usually takes them a little while to get used to them. And what's made the difference has just been the technology of the braces and wires. Like for example, we use titanium wires nowadays, whereas years ago they used stainless steel wires, which generated a very heavy force at the beginning, and that force dropped off quickly, whereas titanium wires generate a very light, biologically compatible force that works away on the teeth the whole time in between appointments, and then that way we only have to see patients about every 8 or 10 weeks nowadays.
And even the approach the first time, for example, I had sort of a significant overbite, it seemed to be to push the teeth, force the teeth into the existing space, whereas now like that widening, which makes so much more sense, is like give the teeth the room they need to form their optimal shape.
Well, that's exactly right, and you kind of alluded to it earlier when I was watching two of you chat. The forces are so gentle now that basically it just guides the teeth, and it allows the tongue and the cheek muscles to find a balance, because often people's teeth are crooked and not positioned properly because the forces are not balanced. So the wire will just guide the teeth, and then the tongue will actually take over and give patients a nice wide, broad smile these days, which is what everyone wants, and it can even help with better tongue positioning and breathing and things like that.
I was going to say that, you know, most people think of braces and orthodontics as purely aesthetics, but there's what other things are you treating when people are getting braces?
Like speech even, you'd think. And
yeah, there's been some studies. I don't think it's proven yet, but there's some studies starting to allude to the fact that it can help with breathing and asthma, and also if you change the tongue position by creating nice broad smiles, it allows the tongue to take a proper position in the mouth and will actually allow children's jaws to grow properly, so that they can, if you treat them at the proper age, it can actually help correct substantial overbites and allow their jaw to grow forward so they don't have a small chin.
So as a mother of, I think, some orthodontics candidates, and people watching, you know, I know at the time it was like 12, 13, we had to wait, but it seems, is it younger now to like do at least some type of intervention as they're still growing?
Well, it's a great question, Callie. We do like to see patients for their first orthodontic examination by about the age of 7, because that's when their first permanent teeth are coming in. And there's some things that you can do that are very basic at the beginning to help even prevent later on comprehensive orthodontic treatment, or at least to make it less complex later on. Like sometimes we'll widen the palate, or even a simple act of removing some baby teeth a little early to allow the other teeth to erupt better.
Are we relying on our dentist to refer us to somebody like you, or how?